Hello everyone, our group is going to talk about immunizations. We want to emphasize the importance of vaccines for the pediatric population. These are the different vaccines we are going to talk about and when they are due from birth to 18 years of age. Immunizations are divided in three groups: live, inactivated, subunit, or conjugate. Live is when live pathogens are used to produce the vaccine. Inactivated is when weakened or dead pathogens are used. Subunit or conjugate is when fragments or portion of the pathogens are used. Also, when toxins produced by a bacteria are used to produce a vaccine.
Good afternoon, Raylan. Thank you for letting me come into your home and talk to you a little bit about some important vaccines. I know you're a young mother, and I just wanted to go over two with you today. Hepatitis B, it is given in 3 IM doses. That's in the muscle. Okay, so it'll be a shot for her. I know that's good. Kind of sounds scary, but it'll be okay. She's going to get it. She got it as a newborn 2 months and her 6 months. The importance of Hep B is it causes severe liver inflammation that can be life.
Hib is an infection that can occur in different body parts that can lead to serious complications and even cause death. There are usually 3 or 4 doses depending on the type of vaccine that you receive. Kids under 5 are the ones who normally need the vaccine, and people older than 5 years old don't need the vaccine unless they have complications like sickle cell, have had a bone marrow transplant, or are HIV positive. Who shouldn't get the vaccine? If there's an infant who's less than 6 weeks old, or someone who has had a severe reaction to a previous Hib vaccine. And some side effects are redness, swelling, or a fever. There's also a slight chance that you could have a serious allergic reaction to the vaccine. Only children younger than 7 years old should get the DTaP vaccine. It comes in 5 doses, and they should be given at 2 months, 4 months, 6 months, between 15 and 18 months, and then the last dose should be given between 4 and 6 years old. The DTaP vaccine can be given at the same time as other immunizations that the child is due for. Babies who have a cold or a runny nose, nothing too serious, may be vaccinated, but children who have more severe, serious illnesses should wait to be vaccinated until they feel better. Some side effects included in this vaccine are soreness, swelling, a fever, fatigue, vomiting. Some more serious reactions that can occur are seizure, a very high fever, which would be over 105 degrees Fahrenheit, and also seizures, coma, and brain damage may also occur after receiving this vaccine.
All right, I'm going to be talking about the IPV vaccine, which is the inactivated poliovirus vaccine. This is also known as the polio vaccination. This is recommended for children to prevent polio or poliomyelitis. It is given by injection in the arm or leg. Children should get a total of 4 polio vaccinations. These are given at 2 months of age, 4 months of age, between 6 and 18 months of age, and 4 to 6 years of age. If a child is traveling to a country where the risk of getting polio is high, they should finish all 4 doses before leaving. Some possible side effects of this vaccination are a sore spot where the injection was given, faintness, dizziness, and shoulder pain. And that's it.
Hi, I'm going to be talking about PCV 13. vaccine. So why should you get vaccinated? This vaccine can prevent pneumococcal disease. This disease refers to any illness caused by pneumococcal bacteria. These bacteria can cause many types of illnesses, including pneumonia, which is an infection in the lungs. This bacteria is one of the most common causes of pneumonia. Besides pneumonia, this bacteria can also cause ear infections, sinus infection. It also can cause bacteremia, which is an infection in the bloodstream. Anyone can get this disease, but children under the age of 2, and people with certain medical conditions, and adults 65 years or older, and cigarette smokers are at higher risk for getting this disease. Most infections are mild, however, some can result in long-term problems, such as brain damage or hearing loss. Meningitis, bacteremia, and pneumonia are caused by pneumococcal disease, and that can be fatal.
So we talk about hepatitis A vaccine. So who should get vaccinated against hepatitis A? In children, all children aged 12 to 23 months, and all children and adolescents aged 2 to 18 years of age who have not previously received hepatitis A vaccine should have to catch up vaccination. And how is the hepatitis A vaccine given? The first type, the single-dose hepatitis A vaccine, is given as 2 shots, 6 months apart, and both shots are needed for long-term protection against hepatitis A. The other type is combination vaccine that protect people against hepatitis A and hepatitis B. The combination vaccine can be given to anyone 18 years old and older, and is given 3 shots every 6 months. All 3 shots are needed for long-term protection for both hepatitis A and hepatitis B. Who should not receive hepatitis vaccine? People who ever had a life-threatening allergic reaction to hepatitis A vaccine, or who are known to be allergic to any part of the hepatitis A vaccine, should not receive the vaccine. Tell your doctor if you have any severe allergy. Also, the vaccine is not licensed for use in infants under 1 year old.
The mumps is a virus that is spread through respiratory droplets. These droplets become airborne when an infected person coughs, sneezes, or talks. Touching surfaces that are contaminated with the infectious droplets provides for another mode of transmission. There are no specific treatments or cure for the mumps. Treatment is supportive in providing comfort and more specific treatment of the symptoms. Signs of the mumps include fever, headache, swollen salivary glands, muscle pains, and pain when chewing or swallowing. Mumps complications include meningitis, testicular inflammation in males who have reached puberty, among whom about half experience some degree of testicular atrophy. Inflammation of ovaries or breasts in females who have reached puberty, and permanent deafness in one or both ears. Before the mumps vaccine, this disease was one of the major causes of deafness in children. The mumps vaccine was developed by Maurice Hilleman and licensed for use in the United States in 1967. Rubella is spread by airborne respiratory secretions. Therefore, it is transmitted the same way as mumps or measles. Just as the mumps, treatment is supportive, providing comfort and more specific treatment of symptoms. Signs of rubella include rash, mild to moderate fever, red inflamed eyes, swollen lymph nodes at the back of the neck, and arthritis, most commonly seen in women. The picture on this screen shows a child who has contracted rubella. You can see the eyes are inflamed around the orbits there, and that the child has a severe rash. Complications of rubella are more prevalent in adults and include arthritis, encephalitis, and neuritis. In children, rubella is usually mild. A woman can pass rubella in utero to the unborn fetus. Rubella can cause spontaneous abortion or preterm birth. Infants that survive may suffer from a range of birth defects, including deafness, eye defects, cardiac defects, mental retardation, bone lesions, and other anomalies. The MMR has been scrutinized by many. In 1998, the Lancet Journal published that the MMR was linked to serious health risks, namely autism and inflammatory bowel disease. Since the publishing of the article, the Lancet Journal in 2010 retracted their statement, citing unethical practices and incorrect information. Since then, many studies have looked at the vaccine and any possible connection to these conditions, and to date, no such data has been produced. The chicken pox is easily transmissible from person-to-person contact. In children, the first symptom of chicken pox is usually an itchy rash that appears on the head and spreads down to the trunk and other body parts. The rash becomes raised and blisters form. Blisters may also form on mucous membranes, such as inside the mouth, nose, throat, and vagina. The blisters crust over and disappear within 10 to 14 days. In adults, the first symptoms of chickenpox may be fever and tiredness a few days before the rash appears. Children may also have fever and tiredness along with the rash. People who have had chickenpox are at risk later in life for shingles, which occurs when the varicella zoster virus is reactivated. Chickenpox is usually a mild disease in children, and they generally do not experience complications. In some cases, however, secondary bacterial infections related to lesions can occur. Other possible complications include pneumonia and neurological complications. Complications are more likely for children under 12 months of age and anyone over 15 years of age, and people who have weakened immune systems. Chickenpox infection in pregnancy can be risky to the mother, to the pregnancy, and to the newborn. The chickenpox vaccine is a live attenuated vaccine and is not recommended for people with weakened immune systems. It is available as a single vaccine, and it is also available as part of the MMR.
Okay, so I'm going to talk about the HPV vaccine and the MCV4 vaccine. Okay, so the HPV vaccine, why to get the HPV vaccine? So the CDC stated that the HPV vaccine is effective. It provides lasting protection against the HPV infection that commonly causes cancer. This vaccine is recommended for children at age 11 to 12 and can be given up to age 15 in two shots, 6 to 12 months apart. Okay, so the HPV vaccine, the HPV is a sexually transmitted disease, so it is best for them to get it before you become sexually active to get more protection. Children who actually get this vaccine over the age of 15 or on their 15th birthday, or people who weaken immune system, get actually 3 series vaccine in a 6-month period of time. Facts about this vaccine is that this vaccine do not cause infection. It will not cause cancer, and it is made from one protein extracted from the virus that is not infectious. Okay, so the MCV4 vaccine, why people get this vaccine? According to WebMD, this vaccine actually is a preventative measure against the meningococcal disease. It is recommended for children at ages of 11 and 12. Booster will be given between ages of 16 and 18. It is also recommended for people who work in or in certain environments, so like college freshmen, living in dorms, military recruits, someone who have damaged or removed spleens, someone with terminal component deficiency, an immune system problem, microbiologists who routinely work with the exposed bacteria, people who travel or reside in certain countries, someone who has been exposed. Facts about this vaccine: it does not give the meningococcal disease. The vaccine does not prevent against all strains of the disease, but it lowers the risk for contracting the disease.
We'll continue talking about meningococcal disease, and the vaccine I'm going to talk about is type B. So meningococcal disease can cause meningitis, which is inflammation of the brain and spinal cord, and also it can cause blood infection. So it's a very important thing to make sure that we get this vaccine. These are the different side effects of this disease. If your child gets sick, they're gonna have fatigue, vomiting, fever, and altered mental status, and etc. And since this vaccine came out in 1970, the cases of meningitis disease have come down a lot, as you can see on the screen. And here we have the people who should get this vaccine, which the people that are high at risk is teens and young adults, and this vaccine should be get from 16 to 18 years of age.
Do a little bit of V. Did I just say V?
Yeah.
V. Did I just say V?
Yeah.
Next member. That was awkward.
So bacteria